Hello everyone, my name is Jalen Jones, digital producer here at WRAL. If you're watching this video, like and subscribe on YouTube. If you're listening to this on podcast, make sure you rate us, review us, leave us 5 stars. The WRAL community is what makes us unique, and we always love hearing from you guys. Thank you guys so much for your support. Had a great conversation with Alex Littlehales. Opioid overdoses are down. Same with fentanyl overdoses here in North Carolina. Alex breaks down those numbers, what it looks like, and basically these campaigns that you see on TV, pamphlets, medical technology advancing is working. So this is good news for the community. Tune in to see what these numbers mean and what this means for you and your community. An analysis of state health data shows that opioid overdose hospitalizations have decreased by more than 20% in the last year, marking 2 consecutive years of downtrending emergency department visits in North Carolina. The same data source shows similar trend lines for fentanyl positive deaths, which decreased by 24% in the last year. I'm here with the man behind this story, Alex Littlehales. You're new to the area, but not new to reporting at all. You've hit the ground running. Tell me about this story.
Yeah, so I am someone that I have a wide range of stories that I like to cover, but one of the categories of stories that I really like diving into is anything that there's data on, right? Mm-hmm. Because, I feel like data is sort of one of the foundations of journalism. So whenever there's a topic that I think I can dive into when it comes to like a data and information standpoint, I always like doing it because I feel like it, kind of paints a picture to something, to a topic that people are maybe curious about, yes, or they don't understand how to relate to it, right? And so the data we're looking at here, so this is essentially a story idea that I had because the North Carolina Department of Health and Human Services, they keep county-level data every month on kind of 2 main subcategories of drug use. So it's opioid overdoses recorded in emergency departments, and then it is fentanyl positive deaths. So those are the 2 categories of, again, the department tracks data for a lot of things.
Yes,
but
they do.
When we talk about specifically county level reporting, these are 2 categories that I found that they do a really extensive job of keeping tabs on.
Absolutely.
And so monthly, they publish these reports, and December of 2025, that month was published in late January. So when we were all in the middle of the winter storm and just kind of preparing for it, this data went out for December, which means that essentially the entire year of 2025, we had a year-over-year ability to look at opioid overdoses for 2025. We could look at fentanyl positive deaths for 2025, but then we could also look at how that compares to 2024 and 2023. And as you had mentioned, some of the key findings in this reporting is that in the last 2 years, so you had mentioned in the last year, opioid overdoses are down by more than 20% when we look at a statewide picture.
Yes.
And it is worth noting that there is a caveat in the data that, this is just a subsection of data, right? This is a small sliver of the issue because we're talking about overdoses that are recorded in emergency departments specifically. So, obviously there's people that can overdose and they don't go to an emergency department, but it's hard to necessarily keep data on that. That would be a much more comprehensive, and that'd be that'd be a lot of data, right? So this is kind of like a snapshot to a larger issue. So you had mentioned the percent change in the last year was 20%.
Yes.
The percent change in the last 2 years we found is 48%, so almost half. So when we talk about opioid overdoses tracked in emergency departments across the state, in 2023, the state saw 9,624. In 2025, they recorded 4,960. And again, that is an undercount because not every single county we found is part of this county level reporting, but a majority are. And just because we don't have all of the data, 100% of the data, doesn't mean that 20, 25, 30% of what is available still tells us a bit of a picture and helps us tell a story.
Yeah, absolutely. You know what? Like I was telling you this before we started recording. This is good news. This is good news. That means that those campaigns are working, the commercials are working, the efforts to reduce overdose deaths are working, and or technology is catching up to people who are able to help those people that are in an active overdose as well. You know, a little bit of lore unlocked when you, in the beginning, you said you love data analytics. Jack Hagel, our NC Capital editor, he always told me what makes a good journalist that is good at math.
Mm-hmm.
And
yes,
I love,
that's true. I've heard the same thing from him. You know,
yes.
Every story is just a number story or a budget story when you boil it down to.
Exactly. And budgets show what their goals are and what people value, or politicians as well. So I love that point. So we're here in Raleigh. Let's talk about Raleigh. So you talk about North Carolina as a whole. How's Raleigh doing?
Well, Raleigh, you know, what we looked at, so the numbers that we just gave was statewide data, right? And countywide, because they publish most of the counties for the state as part of this data tracking, we pulled essentially the
Wake County.
We pulled Wake County. We pulled Johnson County. So we pulled essentially we tried to find information on the more than 20 localities that surround Raleigh. So Wake County, you know, down Sampson County, Cumberland, you know, essentially everything that encircles the Raleigh Metro DMA. Yeah. And so what we found there was that there were a couple of counties that did not report opioid emergency department visits, overdoses. But a majority did, and what we found was that when you average the localities that do report these numbers, that you're getting we can say that the Raleigh metro area is seeing a roughly 43% decrease in opioid overdose emergency department visits. So about in line with the state level. Obviously, we don't have we don't have a couple of counties, and so who's to say that if we were to include those counties that it would be exactly the same as the state rate? But I would kind of
we're in the ballpark range.
It's very similar, right? And so I think the biggest takeaway from the Raleigh metro area data is that, you know, there are some take for instance Wake County. So Wake County in the last 2 years seen a 40% reduction in opioid overdose emergency department visits. And a lot of the 2-year averages for these counties is in that range. So, you know, 40%, upper 30s. In the last year, Wake County, because they made so much progress between 2023 and 2024, the difference, the gap was less for 2025 and 2024. Does that make sense? So it's like you're seeing such a, like in Wake County's, in the example of Wake County, they decreased 13% in terms of opioid overdoses last year compared to the year prior. But when you look at a 2-year span, which I think is important when you talk about this story, because, you know, I just think 1 year is not a good representation, because things can change a lot or not a little in 1 year. But when you look at 2 years, that's a really good sample size. So, 13% drop in the last year for Wake County, but a 42% drop between 2023 and last year. So that's a reflection of how much the issue is trending.
Yes.
And so I think it's also worth noting that Wake County is just one, right? And obviously Wake County is the most populous of the area in terms of localities. So they have the most like cases.
Yes.
Right? That doesn't mean that they necessarily have the per capita rates that other counties do. So, for instance, let's take a look at some of my data here. Let's talk about Wilson County, because Wilson County is a story that is a place that I highlight a little bit in my story. So, Wilson County is a little bit more of a rural part of the DMA, and what we found is that Wilson accounts for so in 2023 they had a 151 count for opioid overdoses. Throwing a lot of numbers at you. I'm sorry.
No, you're good. You're good.
So in 2023, 151 cases, right?
151 cases.
And then in last year, they recorded 62.
Oh, wow.
So that's a 60% decrease in 2 years. And now, obviously, that is when let's compare Wake and Wilson counties, right? 327 opioid overdoses in Wake for last year, 62 recorded in Wilson. Obviously, Wake has more of these cases because there's more people.
There's more people. Yeah.
But what's interesting is that I think you need to look at rural counties when you tell this story because, yes, there's less actual case counts, but the per capita number is way higher. So when you're talking about overdoses per population of 100,000, these rural counties in some cases may have a numerically far less value, but their per capita rate is far higher. So that's why when we're talking about data and trying to define opioid statistics, you can't just talk about the Raleigh surrounding metro area. You need to talk and look at what kind of community advocates and what people are doing in the outlying areas, because those are communities where they feel like opioid use and substance abuse is really high, because when you talk about the effect it has on the respective population, it's just far different. And so, that was just an observation that we make in our story, is that, a lot of these counties, the more rural counties, when you get outside of Wake County, trying to look at another, Harnett County, both of those counties experienced a 60% reduction in opioid overdoses in emergency departments over the last 2 years. So you're kind of outpacing other more urban centers, basically, in the Raleigh area.
And the reason why you're talking about per capita, I'm going to switch gears a little bit for the audience. When you're talking about per capita, it's important to know, so for example, the NFL, Texas and Florida have the most players.
Yeah.
But you have a small town in South Carolina and a small town in Georgia that with residents of 50,000, 75,000 that sent 12 players to the NFL.
Yeah.
They have the most NFL players per capita. But we all know Texas and Florida and Houston, Dallas, Miami have a lot of NFL players as well.
Yeah.
Now, how this relates to the numbers of what you just said, you can really tell effective change is happening because these rural counties with less people are having bigger drops, correct?
Yeah, I think it's whenever you look at, per capita, or looking at something on a per capita basis is always really useful, and it comes up a lot. And to kind of peel back the curtain of reporting, it peels back the curtain a lot for crime, right? How does crime, obviously, the raw numbers for crime and gun violence and things like that are going to be higher in major cities. But, part of our job as reporters is, a lot of times there's these issues in smaller communities, but when you consider and factor in the amount of people that live there, that's what makes it the story for that locality.
Exactly.
And so your question was about per capita, right?
Yeah.
And sort of just like the importance. Well, yeah. I just think it is well, I'll put it this way. I think a lot of times too, when you get outside of the immediate urban area of like Wake County, when you go and talk to, folks making a change in other rural areas or outlying areas, these people are, one of 20,000, one of 30,000, as opposed to one of 500,000, right? So I think you can sometimes see that work goes a longer way. Not that it goes a longer way per se, but the work done by one person means something different in a community where there's less people.
Yes.
Right? So in a larger city like Raleigh, you have, because there's more people, you have to have a lot of more cooks in the kitchen per se to like see that change, right? But when you get down to these more rural communities and more suburban areas, you can really see that in some cases one person can make a difference. And one person can always make a difference. That's not me saying, that they can't. But take, for example, another area that we looked at for this was Edgecombe County. Now, Edgecombe County, near Rocky Mount, if I have my numbers here, opioid overdoses down 28 or 26% in 2 years, right? Okay. So what does that mean? So again, a more outlying suburban area of the Raleigh area, 26% decrease means just 16 cases. Okay, so I don't think the numbers tell the full story, and that's why it's interesting to do these stories, because numbers are a tool, but they're not the whole story. Yes. So when we went out to Edgecombe County, we talked to a guy named Dalton Barrett. He is essentially one of the leaders in their opioid response, and he actually helps oversee where dollars are spent from the opioid settlement funds.
I have this pulled up. Dalton Barnett, Edgecombe County's opioid settlement program director in 2023. He oversees the county's allotment of $5 million in settlement funds distributed between 2023 and 2028.
Yeah. So he, is kind of the decision maker behind, and some background for this story is important. The opioid settlement dollars from a couple of years ago, North Carolina received, I believe it's 1.4. The total. If I'm trying to remember my math right, it was $750 million.
Gotcha.
Which
yes,
was
sir.
a part of a. Oh gosh, I'm sorry. There's so many numbers out there, but essentially, long story short, we don't have to get too in the weeds. Every locality in North Carolina receives millions of dollars in opioid settlement funds that attorney generals across the country. They essentially sued for this money, and now they're distributing it back into local communities, right? So in Edgecombe County, for example, their allotment of those opioid settlement dollars, $5 million. So Dalton, who we talked to for the story, basically he oversees how does the county spend the $5 million that we get here? How do we reduce substance abuse? How do we reduce deaths? And so what we did for the story is we actually rode around with him as he's in his, basically his response van.
I love those stories.
Yeah, right. And he's just, he wasn't doing anything necessarily like out of the ordinary. He was just driving around in his EMS truck that he responds to for cases, and we were just chatting. And he made a point that, so if we switch over to fentanyl deaths, which is another kind of subset of this story, Edgecombe County reduced its number of fentanyl deaths by half, essentially, in 2 years. So 19 to 8. Again, not crazy numbers, but that's, in theory, 11 more people that are, alive on an annual basis. Yes. And that's important.
Yes.
So when we talk about rural and communities and changes at a county level, those are stories that are really important, right? It's okay. Well, here's Dalton, right? And so maybe Edgecombe County isn't the most populous area in the Raleigh DMA, but when you think about, he's overseeing millions of dollars in dispersed funds for the next, decade plus, and then in 2 years since he kind of transitioned into this role, he's able to say, we reduced our fentanyl deaths by half. And he said something also in that car ride. He said, we did not have someone younger than 25 years old that died from a fentanyl-related death.
That's powerful.
And that was something that he was it's weird to be proud of something like that because we're talking about life and death. But he was, really proud of that fact that, that is a demographic of people that an age where someone could get maybe addicted to opioids and it just kind of persists with them for their life. And you can debate about how much of an impact the things he's done and those dollars spent, if that's the reason why someone younger than 25 didn't die. We can't say that there's like A equals B. But you can say, we're spending a lot of money to reverse these trends. We're obviously putting a lot of care into the community. And, oh, by the way, we just hit a statistic that I haven't seen before and not recording a death.
It's a very powerful statistic.
And that was just like one of the things I think when you're in this field, it's probably like one of like the small wins you probably take when you're constantly dealing with substance and opioid abuse and addiction and things like that.
Absolutely, absolutely. Well, Alex, thank you so much for your time. You guys can catch all this reporting on WRAL.com. You're going to go to our Investigates tab, and that's where you're going to see this pretty expansive report. We have charts, we got numbers for you, everything. Alex, you've done an amazing job with the story. Thank you so much for your time.
Yeah.